Good morning all. Myself Nandini, working as a lecturer in Faculty of Physiotherapy, Dr.M.G.R. Education and Research Institute. So today I am going to discuss about muscle strength techniques. So yes, coming to the point, what is the strength? So the ability of the muscle to contract or to increase the tensions to overcome a resistance or the force which is applied externally to produce a movement. So yes, what give you the contractions? The muscle has a structural unit which is called muscle fiber. The muscle fibers which is enclosed in a sheet, elastic sheet, that is called as a sarcolemma. So we have two fibers. So one is red fiber and one is white fibers. Why the muscle fiber is red? It has an increased blood supply, so it is red. It is a slow contraction muscles. So it has an sustaining thing. So whenever we work for a long standing, we usually call it is an anti-gravity muscles. The white fibers, which is a fast contracting muscles, which will usually go for easily fatigue. Okay. So what are the types of contractions? We have isometric contractions and isotonic contractions. So what is isometric contractions? So the length of the muscle, it doesn't change at all. So that is called as isometric contractions. So what is isotonic contractions? So whenever we give any resistance to the movement, okay, the muscle remains same tone, that in the sense same resistance, but there is an alteration in the length of the muscles. That is isotonic contractions. So yes, then what does the muscle works? We have three components. One is isometric, that is static works. The other is concentric, then the other is eccentric. So as I discussed before, isometrics, so there won't be any length changes in the muscle contraction, muscle length, okay. So then is concentric contraction. So what is concentric contractions? So whenever we give the resistance, okay, the ends of the muscle length, right, so it will comes closer to the center point, that is it will contract to the center points, that is concentric contractions. So what is eccentric contractions? So the muscle remains lengthening, the attachment points bilaterally it will remains in the lengthened state, that is stretched state, that is eccentric contractions. So yes, what we have the range. So muscle usually have the range things. So we have a four component. One is full range and the other is inner range, the other is outer range, the last one is middle range. What is full range? So the length of the muscle, it remains same and the joint movement, right, it will be in the full extended state, that we called as a full range of motions, okay. The other is outer range of motion. What is the outer range of motion means? From the lengthened state to the middle, the concentric contraction we told, right. So the midpoint of the contractions. So from the away from the point to the middle point, okay, that is outer range. Then what is the inner range? We call from the concentric thing to the partial contractions, right. So from the middle concentric contraction to the inner aspect, that's towards the attachment of the muscles, that is called as the inner range. Then what is the middle range? So it will sustain in a partial contraction state, it won't be in the outer range and it won't be in the inner range. So the middle portions, right, we call this as a middle contractions, middle range of motions. So usually in our day-to-day activities, we will use the middle range alone, okay. Then we have a muscle group actions, okay. So whenever we move the joint, the muscle does not act individually, okay. So group action of muscle activity. Usually the muscle does not work individually and it will not produce a movement. So muscle will act group, like group of muscle will produce a movement, okay. So we have a agonist or prime movers. The second one is antagonist, the third one is synergist, the fourth one is fixator. So what is agonist or prime movers? So when we produce a movement, so the muscle which is responsible to move a limb, that is the prime movers or agonist, okay. It will contract concentrically and it will produce a movement. The second one is antagonist. What does the antagonist do? So it will lengthen and it allows the prime movers to move the joint, okay, move the limb. So that is the antagonist. The third one is synergist. What the synergist will do? So synergist, it will give the pathways to move the prime movers, that it will like allows and it will also contract or it will lengthen to produce the movement, okay. The fourth one is fixator. What the fixator will do is, it will steady the movement and it allows the prime movers to move in a fixed pathways. Okay, that the group of muscle activities. The next one, it's an important thing, the principles. Okay, what are the principles of strength training exercises? So usually when we train the strength training, what we have to do is, we have to focus on the whether the joint is having the full range of motion, and the person who is performing the movement, he has to do the active movements. Okay, then the first one is whether the joint is having the full range of motion. The next one is the person has to do the movement actively and they have to participate in that strength training exercises. So majorly we have a fit principle. Okay, what is the fit principle? The first one is, F stands for frequency, I stands for intensity, T stands for type of training what we have to do, and the last T is what? Timing. Okay, so what is the frequency? So usually whatever we give the exercises, the strength training exercises, we should know that how many frequency, that how long they have to do, how many times they have to do, that is the frequency. So how we will frame the frequency of the exercises? So we have a DLOMS techniques, that is 1 repetition, okay, maximum. So whenever we do the resistance training, right, so the maximum resistance, the maximum load, okay, the persons have to carry that, and we will produce the movement with a full range of motions. So like that we have to repeat it for the 10 repetition maximum. Okay, if the person can do the 10 repetition maximum with the higher concentration of the weight, so that is their 1 hour. Okay, so we have to do that type of frequency, that is repetition maximum. Okay, then is the intensity. What is the intensity means? The weight, okay, the resistance, what we will give, okay, and we are doing it for a 10 RM, right? So the 10 repetition maximum. So with the weights, whether it can be with the dumbbells, or it can be with the sandbags, or it can be with the elastic therapeuts, or else the therabands. Okay, so if for example the subjects, they can carry the 2 kg of dumbbells, right? So with the dumbbells for the 10 repetition maximum, that is the frequency and the intensity. Okay. Next is the type of training. What type of training we are going to give? Whether we are going with the isometric training, or else we are going with the eccentric training, or else with the progressive resisted exercises training. These things to be framed. Okay. The last one is timing. So the timing is the altogether the duration of the exercises. For example, we are doing the bicep strengthening or else the elbow strengthening exercises, right? So if we do the elbow strengthening exercises, the repetition maximum we already fixed. Okay, so for 10 repetitions, that frequency with 3 sets or 2 sets, okay, with intervals, that should be the duration. So the for one exercises with intervals 10 minutes or 15 minutes, what does the patient is going to do? That thing we have to fix. These are the principles. Okay, then the major thing, what will improve? Okay, so what are the benefits of strength training exercises? We have to focus. So the first thing is the muscle weakness. If the muscle weakness, patients will come, right? So it will improve the strength of the muscle, it will improve the range of motion, and also if it will prevent the traumatic conditions, right? If any sports player they are coming, okay, if they are practicing too much, so the muscle will go for micro tear and things like that. So if we train the strength training things, so these can be avoided. Then what are the contraindications? If the persons or the patient is having the dislocations or else any other fractures at that time, okay, so the strength training can be avoided. Okay, so we will move on to the exercises. Okay, so first we will focus on the scapular strengthening exercises. So we have a model, we will do with the exercises. Okay, first we will start with the scapular strengthening exercises. Okay, so we have a model here, so we will see the scapular strengthening exercises. So initially the subject has to be lie down in the supine lying and the both knee in the flexed state, okay, so that their back will be in the relaxed state. So they have to, their elbows and the arms is totally have to parallel to the body alignment. So now he has to press against the couch, press. So we have to see whether the shoulder is in the right position, the scapula is in the fixed state, okay, his neck should be in the neutral state, okay. He has to hold, okay, for the 10 seconds. Now we are going to train the isometric training. So we can change the exercise protocol, that whether the subject has to do the isometric training or else he has to do the eccentric training or else he has to do with the resisted exercises training. Okay, now he is going to do this isometric training. Press. Now he is going to hold it for the 10 seconds. Okay, relax. Now I am giving the intervals, then I am repeating it for a second set. Hold, relax. Now I am repeating it for the third set. Okay, so now you can able to differentiate with the frequency, that is the repetitions. Okay, how long he is holding the repetitions and the sets with intervals. Okay, relax. So initially we done with the parallel aspect, that is the 0 degree of contractions. Okay, now we are going to keep his elbow and arm in the 45 degree of contraction. Okay, now again he is going to do a isometric contractions. Hold it, relax. Hold it, relax. Hold it, relax. The third level of training is 90-90 angle. Okay, the shoulder and the elbow should be in the 90 angle, and again he has to press against the couch. Relax. 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 So likewise we have to train the scapular muscles. The next is we can alter the patient position according to his needs. Okay, so initially we trained in the lying position, the scapular things, so we can use the standing position with the wall support, and the same things can be repeated. So now I am going to use him in a standing position for the shoulder strengthening exercises. So for the shoulder strengthening exercises, I am using a resistance, that is dumbbell, 2 kg dumbbells. Okay, so now I am going to train the flexors group. So shoulder is going for flexion. So as I said, the principle, it has to cover the full range of motion. Okay, now again he is coming back. He is repeating it for 10 repetitions. Okay, and with intervals I am repeating it for 3 sets. Down. Then is extension. So body has to be straight. He has to hold the dumbbell, and we have to note whether the joint is moving with the full range of motion. So now we are going to train the abduction. So he has to do the scapulohumeral rhythm movement, and with the full range of motion, again he is taking it back. Then he is going to do the rotation movements, that external rotation when standing position itself. So he has to fix his elbow, then just like how the door will open, right, in the plane, the same thing, the external rotation has to be done. Good. Then the internal rotation, if he is comfortable in the standing position itself, we have to do whether the shoulder and the elbow, it should be in the 90 degree angle. So followed by external rotation, we are going to do internal rotation, so that the shoulder and the elbow should be in the 90 degree angles. Then he has to do it in the downway method. Followed by external rotation, we are going to do now a internal rotation. So for internal rotation, with the same resistance, the shoulder and the elbow should be in the 90 degree angle. So this is the neutral position. From this, we have to do the internal rotations. If the patient needs a support, we can give a minimal support, okay, with the fingers. Repeat it. That's it. So we're done with the shoulder strengthening exercises. Now we are going to do the elbow strengthening exercises. For that, the patient has to be in the supinated state. Now he has to do the elbow flexion to extension. Now for the extension, elbow extension, how we can do is, we can use a normal wall push-ups, okay, with the wider base, and we can do it. Now I am going to train with the dumbbells. Okay, he can place his hand back near the scapula lever, the elbow now in the flexion state. Now he is going to extend his elbow up, down. So we can see the muscle is getting contracted and relaxed. Down, down. Now followed by elbow strengthening exercises. Now we are going to do a forearm strengthening exercises, which we have a 2 movements, that is pronation and supinations. Now the elbow has to be in the mid prone position. From this he has to do the pronation, then coming to the neutral position, then supination and back to the neutral. Like this we have to do the repetition and the sets with intervals. So followed by forearm supination and pronation. Now we are going to do a wrist extension and flexion training. So for that the wrist has to be in the neutral state. From this we are taking it to the extension state. Then neutral, up, neutral. So like this we have to do the repetition and the sets with intervals. Now he is going to do the flexion movement. So for that the forearm should be in the supinated state. From this he has to do the flexion to the neutral, flexion to the neutral. After flexion and extension, now we are going to concentrate on the ulnar deviation, where the wrist will be in the neutral state, and then take it to the ulnar deviation, then neutral to the ulnar deviation. After this ulnar deviation, we are going to concentrate on the radial deviation. So whatever we do, we have to start from the neutral state to the full range of motion. Relax. So after wrist, we are going to train the hand strength training exercises. For that hand strength training exercises, we can use the smiley ball, which is very soft in nature. We can use that for the prehension things, and also we can clay molding we can use. And if the towel or else the kerchief is there, so we can squeeze it. Like now we have to fan all the fingers, with the fingers will be in the abducted state. Now he has to do the IP flexions with adduction. Again he has to squeeze it back, then IP flexion with adduction, then again squeeze it back. Okay, we can give an scissor cuttings, or else with the strength training cutters where we will have that resistance. We can use these things and all. So now we are going to do the cervical, that is neck strengthening exercises. So for that I am using isometric techniques. Okay, so now what he is going to do is all for direction resistance, that is on his right he is going to give a resistance for the lateral flexions, and for the left he is going to do the lateral flexion resistance. Okay, and the same thing, head should be in the neutral state. Now he is giving pressure, that is the resistance coming from his palm, and the head is the same thing, the same resistance is giving back to him, and he is holding in a neutral state. Now he is repeating on this side. So whenever the neck muscle is weak, we can see some sort of flickering here. Relax. Now he is going to do for the neck flexors. So for this we can use a pressure biofeedback also. So in that we can place under that, like in the PG levels we can see the pressure gauze is there. So they will place under the neck and they will do a contraction, and they will see some sort of like deflections. Okay, so now he is going to do with the fingers. So the fingers has to be placed near the mandible region, and he is giving a downward pressure. The same equal pressure is giving back from his finger, and he is holding it. So already I told this is an isometric strength training exercises. Relax. Relax. Now he is going to do for the extensors. So he is going to place his hand behind the occiput region. Head should be in the neutral state. Now he is going to resist it back. So he is holding for 10 seconds. Relax. So I am going to summarize whatever we see now. So initially we seen about what is strength, and we seen what all the types of contractions and what are the muscle actions and what is the range of those muscle works, and we saw the principles of strength trainings, and added to that we saw the benefits of strength training, and we saw the practical sessions of strengthening the neck muscles, scapula, shoulder, forearm, elbows, wrist and hand. So further session we will see about the vertebral column strengthening exercises, pelvic and hip, and in further session we will see about the vertebral column strengthening exercises and hip and knee, pelvis and foot. So further on we will see about the spinal strengthening exercises and lower limb strengthening exercises. Thank you.